Welcome to Your Health. I'm Melinda Meza, and this week we have Dr. Walter Tom with us from Aesthetic Laser and Vein Center. Exciting things happening. I hear about this vampire lift.
Yes, Melinda. It's the latest rage in Hollywood, the vampire lift.
But we have it here in the North Bay. Tell us about it.
We do. It's a unique way of regenerating ourselves. The future, in my opinion, of cosmetic procedures is regenerative medicine, taking a part of us and regenerating what was good. So the vampire lift, and they get the vampire word because we draw blood from our cells like a lab draw, and we spin it down and we take the growth factors from our blood and we can re-inject it into our face, and it actually makes our skin more youthful, adds a little more volume, plumps up our skin and our cheeks, and just gives us a more vibrant look that looks very natural.
Amazing, because I'm looking at before and after pictures and you could really see the difference. So this is your own blood, nothing else is used, and it actually gives your skin that lifted appearance.
Yes, absolutely. That's what's so nice about it. And again, being from Northern California, we tend to be more of a naturalist kind of part of the state, aren't we? And everybody's always concerned about, oh, if there's something foreign that we might be putting in our bodies. So this is perfect for that subset of patients. It's your own tissue. We're taking your own growth factors, which will stimulate certain cells in our system to lay down more collagen. And also, sort of the real cool word nowadays is the stem cells. So these growth factors can actually stimulate our own stem cells to generate or regenerate more tissue for us.
Amazing. I mean, I understand they used to use this for burn patients and in orthopedics. It's your body helping itself heal. Now, what about maybe patients that are a little older, maybe need a little bit more, but not quite wanting a facelift or something so dramatic?
And there are a lot of patients who don't want to go the facelift route. So they're going to be people like me in their mid-50s, okay? And
which
so
you don't look like you're in your mid-50s.
Thank you. I appreciate that. But really, we're looking at probably patients in their mid-40s, even into their 60s. Those patients, I believe, do very well with facial fat grafting.
Okay, so you're using your body's own fat. Like you could literally take fat from a different part of your body that you don't like so much and then add it in areas that you need some.
That's correct. So again, what we do under local anesthesia, because we're the local anesthesia place, all under local anesthesia. And the best part is there's no scalpels. Okay, these are all with tiny little tubes. We actually suction some fat from an area that you don't like, so it's a twofer.
So my thighs.
It's a twofer. Okay, there you go. See, it's a twofer. It gets thinner thighs, and then we rejuvenate the face. And so what we do is we place fat in those areas where our faces have deflated, and it just gives a very great, in my opinion, vibrant, age-appropriate, natural look.
Now, how long would this last?
Well, typically we tell patients that fat grafting, depending on the patient themselves, can last anywhere from 3 to 8 years.
Wow.
So a long time.
Yes.
But what we're now doing, I'm so excited about, and we're just starting this. In fact, I performed 2 of these procedures today in my office, is that we've taken the cell-filled platelet-rich plasma, or the vampire lift fluid from our own body, and I took that from our patients, I mixed it with their fat, and then we re-injected it into their face. So we're actually hoping that the growth factors associated with the platelet-rich plasma, or the vampire lift, will help to enhance our results even more.
That's wonderful. And you know, with it lasting so long, 5 to 8 years compared to other injectables that last maybe 6 months at the most, this seems to be very cost effective as well.
Extremely cost effective. A lot of times patients will have fillers, the hyaluronic acids, for those who really know the names of these type of fillers, or the cell-fill lift, just using your own serum to regenerate your tissues. And a lot of times I'll use that as sort of the beginning. We kind of just tease the patient a little bit so they can kind of see what it's like to get more volume into their face. Once they see what that's like, then many of them become convinced that going the route of doing facial fat grafting is, again, as you say, more cost effective.
Yes, you know, when I first heard about fat grafting, I wanted to say, okay, fat, I don't want more fat in my face, but I'm looking at these pictures you have here. They're amazing. You see how it actually makes people look so much younger.
It makes them look younger, and typically what they say, Melinda, as you mentioned, is, Dr. Tom, you want to put fat in my face?
Like what? That 3-letter word.
Fat Asian face, okay? and actually what we can do is we can actually make your face look thinner by putting the fat in the appropriate areas. It lifts up, it recreates, especially for women, their sort of triangle of beauty where they want to have high cheekbones coming down to a triangle. It actually lifts it back up. For men, we want more of a square. We want more of a square face, and we can create that as well with fat grafting.
It's amazing. We hear about people in Hollywood doing this, quite a number, and we hear that word stem cells, but this is your body healing itself, making yourself look more youthful, and we can find it here in the North Bay Aesthetic Laser and Vein Center with Dr. Walter Tom. We thank you for joining us. On Your Health, I'm Melinda Meza.